All right, today we are changing out the Gtube. He already had a fresh shower and everything, so I cleaned around the Gtube site, and then we're gonna change that out. So these usually get changed out every like 3 to 6 months. We usually do about every 3-ish months, because usually around that time they end up getting pulled out, like full balloon inflated and everything. Somehow he always manages to pull it out around 3-ish months, so I just try to change it around that time, or just wait till it falls out, basically. Unless it's been like closer to 6 months, then I will change it. All right, all of my supplies. So first we're gonna need to deflate that balloon. His balloon, or his low profile Mickey button, is a 16 French. So it can have anywhere from 5 to 10 mLs. 10 mLs is the max. Never inflate more than 10 mLs, because that'll break the balloon. Always wash your hands before or use gloves. I'm not going to use gloves because it's my child and I wouldn't need to. I already washed my hands. So first we're going to deflate this balloon. So this side area is where you put the syringe for deflating. It's a smooth syringe compared to like some other syringes that I have. These are the lure lock, or they're the twist on. This one's just the smooth one, so this one is just for the syringe for getting the balloon. So I'm going to deflate that. That looks like it's pretty good. Kind of pull it out a little bit. And then we'll use some gauze to help pull it out. He probably won't like this as much, but usually the insert is the part he doesn't like the most. So I'll just pull it out quick, just nice and firm but slow, just in case the balloon was inflated still. And that is the full intact Gtube button, and his hole is open, so you want to make sure you always cover it. There's nothing coming out. I haven't given him his breakfast yet or done any waters in a while, so it is pretty clean, but most people have to put some gauze over there with a little tape. I do not need to do that because his is good. So I'm gonna need to get some new water quick. Hold on just a second. They always say not to use tap water, but I've always used tap water and it's never been a problem. It kind of yellows after a little while, but otherwise you should use sterile saline or distilled water. And he doesn't like his belly showing, so hopefully he doesn't. All right, mommy's gonna show stuff, Kason. And he doesn't like his belly open. He thinks his shirt should be down, because we've done that his whole life, basically, is pull a shirt down for him. So his Gtube wasn't showing. So this is a new one. I'm going to inflate it first to make sure it's working and there's no leaks. This one has a 6 ml, so it's saying that's what you should inflate it to. So I'm just gonna inflate it a little bit and make sure it's good. Sometimes they inflate a little lopsided, so before you just kind of like rub it between your fingers to just help it, because it's obviously been packaged and everything before, but that's basically what it looks like once it's inside. And you can keep this attached. It's probably easier not to, but you can. It doesn't hurt anything, because it's less wiggling around and accidentally pulling it back out. We do want to insert this hard thing because these are very flimsy, so it's very hard to put them in when they're flimsy like that. So this helps it stay more stiff and stable. So we put that in the middle of the button. And this is the part that gets inserted in him. And then we want to put some lubrication on the button, and or I usually just put it around the site, because then you know for sure it's getting lubrication over the area, because he does not like this part. It's not his favorite. It does hurt a little more, I think, because he always seems more uncomfortable. Half the time when his Gtube gets pulled out by accident, is that called? His Gtube gets pulled out, he doesn't even notice it, but he always notices when it goes in. So for insertion, we're going to do a nice slow but firm insertion to make sure it gets put in there correctly. So I have all, no, don't touch it. I have all the lubrication on there. And this is a clean technique. It's not sterile or anything. You just want to have clean hands and or gloves. It's not sterile where you have to do extra things, especially for when you're doing it at home. This is not like a clinic or hospital setting. So we're just going to place firm but slow pressure in there to make sure it gets popped in. Oh, you didn't seem to mind it this time. And then you're going to want to wipe all that lubrication off around so it doesn't get all messy. But you can do that also after you've inflated it so you don't accidentally pull it out. But I've done this many times, so no problem there. Then you're going to want to hold it and then insert that water. So I have 9, so I'll do to the 3 because I have 9 mLs in there now, so I'll do 3 or up to the 3 button, so that's 6 mLs. And then I give it a slight tug and I see that it's not going anywhere, it's in there. And I did forget to mention before you pull the old one out, sometimes it's better to do like a 360 turn and kind of just get it dislodged because it's been in there for 3 to 6 months and it could be a little attached or something, you know, skin likes to adhere to things, so that just helps it get unstuck. Oops. It's not like you have to, but it's best to. It's a good practice. All right, and that's in there okay. I'm gonna dislocate this so I don't keep accidentally de-inflating it every time. Clean around the area, make sure all the lube and water is out of the way, and then I can pull this little blue part out because it is in there and it's stable. And that still feels good to me. It's nice and it's like a happy medium. It's not too tight where it's like stuck to his skin and it's gonna rub, but it's not too loose where I'm like pulling it mostly out. So this is like a perfect length there. And if it becomes too tight or too loose because you've lost weight or gained weight or whatnot, or you've just gotten bigger, you know, talk to your doctor and then they would measure and give you a different balloon size. But for him, he is a 16 French, 2.5 centimeter. The 2.5 centimeter is his length of where the outside is from the inside, I believe. Is that how they measure it? And then we're also gonna put a 2x2 split gauze on there. That just helps keep the button from rubbing against the skin. Even though it's like a perfect length, it can still get rubbed against. And then I just take a little tape and I kind of just touch these two pieces together, put a little under, put a little over, and then it's nicely attached. And then when he takes showers or goes swimming or it's time to change out this stuff, I can easily just rip it right off because it's really easy. All right, so that is in place and it's in there and that feels good. I usually don't need to because I know how his Gtube works and it's great and it never has any problems and it's always in the correct place. But for regular purposes, you want to make sure you're checking to make sure it's patent and everything is connected correctly. This is a Y-port Gtube connector. So this part is like a little lure lock part. You want to line up that little line with the line on the button here. It's hard to see it, but mainly it's towards the balloon end. So you want to insert that, hang on to the G2 portion, and then push that in with the other hand. You're going to want to twist it. I have it in there. And then twist it so it's on all the way. It does like a, not a 360, it doesn't go all the way around, but it goes like more than halfway around it to make sure it's on correctly. Because if it gets pulled the other way where it's line on line, it's going to get pulled out easily, and you don't want that to happen. So you turn it all the way as far as it can go. And then I do have a syringe with water because I was going to do his waters now anyways. So I usually let these lines stay open a little bit in case there is some stomach content so it can come out a little bit. So I'm not just putting straight air in there, but I haven't fed him and we haven't done waters in a while, so he has nothing coming out of there. So I guess he will get a little air, which that's okay, just have a little bit. We're gonna lock that. I'm gonna close one end because we don't want to put water in one end and have it go out the other. I would close that, but I'm gonna keep it open now. Going to lure lock that in, so twisting it in. Gonna unclamp that, and then I'm gonna pull some water out, or contents out. See, some contents did come out. So I know that it's attached, which I personally didn't need to do that. for him, but in normal circumstances, you want to make sure you always get some stomach contents out. And I did, so usually stomach contents are like a yellowish color. Otherwise, whatever color food you just ate, or, you know, clear for water and stuff, and a little bit of sediment and things that are in there. So I'm going to want to push some waters in because it is time to do his waters. And then I'm just going to slowly insert it. You don't want to just rush the whole thing in there because it's just a little too fast, and a lot of people will get like reflux if you're pushing it in way too fast. I mean, it doesn't have to be like 5 minutes to put this in. You know, it should take you 30 seconds to a minute or something. You don't need to count. Just do like a nice pace. But yeah, you just don't want to do it too fast. Otherwise, I could usually start hearing him move around his mouth more because I probably gave him a little reflux there. I know we're doing your waters. Hold on just a minute. We're doing your waters. I'll pull your shirt down when I'm done. And I think most people don't keep their Y-port connectors on, but I give them waters every 2 hours. So I like to keep this on just so we don't lose it, and that I always have one. And, you know, especially if you're going places and you're like, oh my gosh, I forgot to bring the Y-port. What am I going to do? You know, you don't want that to happen. So I usually keep it on, and to secure it more so it doesn't get yanked out, I put a Tegaderm on there, which I have already unpackaged. I'll put it on this side this time. So I peel off that. I kind of place it on there first and kind of crinkle it around there just a little bit. And then I place it on. And so that's making sure, because if I just slapped it right on there over the tube would actually give him an indent, and we don't want to indent his skin and make it uncomfortable and give him a pressure ulcer or pressure sore of any sort. So I kind of secured around the tube just a little bit first and then place it on. So when I take it off in a couple days, when I change the gauze in the tube every few days so they stay clean and dry and everything. But the tube only, or the button only needs to get changed every 3 to 6 months. But I do this, and then he never has any pressure sores. So if you were just to slap this right on there and leave it there for those couple days, he'd probably start getting a pressure sore, and you definitely don't want that. With his skin, I mean, he's young and has great skin, but for elderly people and stuff, they'd probably start getting breakdown. For him specifically, since I keep it on, I do put this. He does wear diapers. So I do put this right down, like right here in front of his private area, but he has a diaper, so we're able to keep these hard parts right over the diaper, and it never bothers him, doesn't cause any pressure sores or anything. And it also helps, so when he's moving around and doing things, and being kind of crazy like he is sometimes, it doesn't get pulled out as well, which is super important. We don't want to pull it out. And this Tegaderm does help for that little extra protection of not pulling it out, but then also keeping it in the pants and not just letting it dangle, so it puts pressure and indents on his legs and not on his stomach. I put it right in front of his diaper. That's a great thing that works for us. So that is putting in a Mickey button. Thank you for watching, and hopefully that was a little more information for you if you have to care for someone that has one, or your child is now getting one, or your mom or dad or anyone's getting one. I mean, I don't think most people don't always use these kind. They all look different. There's like the J-tube, there's a G-tube, there's different things and different manufacturers and different lot of things. But this is a Mickey button, a low profile one. And we picked that because it's low profile. He crawls, he does things, and we don't want it to mess with him or anything. So we got the nice low profile one, and I really enjoy this one. It's easy to care for and everything. And like if you're doing cleaning every few days, I would take this off. I would take the gauze off. I would take like a Q-tip and or washcloth and wash around the area, because it does sometimes get like little crusted, like yellow brownish color crusted stuff, and that's just normal. That always happens. Sometimes the gauze will get a little crusted stuff on there too. That happens every time. It's very normal. He's had this for a long time, so it's very nice and established. His skin looks great, and once in a while it gets a little pink around there from, you know, just rubbing and stuff. Otherwise it stays pretty nice. if someone's messing with the tube a lot, sometimes it gets granulation tissue, and for that our doctor gives us triamcinolone that works really well for the granulation tissue, and it's all like red and inflamed and getting kind of beefy. But generally that does not happen. I mean, like maybe once every like year or two or something he'd get that if it's messed around with too much. Otherwise it stays really nice and clean and beautiful. So that is doing a Gtube insertion. And then another thing that's really important to point out is, I'm sure people would ask why he needs a Gtube. There's all sorts of reasons people need a Gtube, but most of the time it's for they're not getting good nutrition, like they have a low what is it called, failure to thrive, that's what I'm thinking of, where they don't eat a lot and they need that extra supplements and stuff because they're just not good eaters. So babies and sometimes elderly, you know, that happens to them. And then also for people with swallowing difficulties. He has swallowing difficulties. It has much improved. So he no longer gets any formula feeding through here like he used to when he was little, because his swallowing has vastly improved and really doesn't have any more issues, but he still has issues with chewing and stuff, and we still need to puree his food. Otherwise, he eats literally everything by mouth, but because he also has seizures and other little things, he gets medications. And, you know, to give a kid a medication twice a day would be horrible, and I would feel bad having to shove that down his throat, basically. So we kept this on after he was on the formula just to keep, you know, giving him his medications, because it's easy, it doesn't bother him, and he doesn't even notice it's there half the time. So it's so much easier to do that for a little kid that doesn't understand, like, oh, you gotta take your medicine, you know, it's just easier to do this. And he's not much of a drinker, so just to make sure he gets that adequate hydration that he needs every day, we do the big syringes of water. It's just easier to do a couple of those every few hours to keep him hydrated, because he just doesn't drink that much. He does drink, he doesn't need thickened liquids or anything, but he just doesn't drink as much as I do or regular people. So we just do this for hydration and medications, and that is okay. When he was younger, I had much of a harder time with it, and I didn't want it, and you know, I was embarrassed by it, and why does my kid have to have this? And it bothered me a lot. But now that he's gotten older, and now that he's done with the formula, I see, like, yeah, I don't want to have to give my kid and force him to take medications. Like, it's easier to do this. And I want him to stay well hydrated so he doesn't get UTIs or other, you know, things. So this is just easier for doing this, and I understand it, and it works great for us, and I'm easily able to teach others that care for him, like school, daycares, babysitters. They're all usually like about it, but once I show them and have them try it hands-on, they're like, oh, this isn't so bad, this is easy. It's just most people don't see this kind of stuff and don't have to deal with it on a regular basis like I do. So they're very like scared of it and unsure and don't want to hurt anything or break anything. And he's a tough cat, aren't you, baby? So it's very easy to care for and very easy to take care of and easy to learn. It's just, it is different than the normal everyday like most other people deal with. So this is just a nice overview of what happens, what it looks like, everything about it. And that is how to change a Gtube button. Thank you for watching.